I'm joined by Ryan Younger, VP of Marketing at Virtua, and also a board member for SHSMD.
Great to be here, thank you.
Great to have you. How's the conference been?
Oh, really good. I think it's always good, but this one is definitely special.
Yeah. I've known you now for, it's got to be coming up on 10 years between different positions that you've had.
Yeah, for sure.
So tell us a little bit about your journey personally, for those that don't know you.
Sure.
Through your sort of elevation between positions.
Sure. Well, I guess now I'm one of the old guys, because if I think about when I started, I came into healthcare in the late 90s. I actually probably came through a back door different than other people and didn't think I was necessarily going to stay. In graduate school, I was working for a political consultant, and we did a lot with voter mobilization, studying voter behavior, how to motivate people, so it has some relevance. But I got disenfranchised pretty quickly. I figured out I liked studying it, but when I saw what happened on the campaign trails, it was tough. We actually had some recounts where making the exact opposite argument for what should count as a vote changed elections. It was before that Bush Gore hanging Chad, and this was like north and south of Boston. So it was just that got me in there. But the political consultant I worked for knew the COO of a large health system, introduced me, did an interview, and again, a lot of health systems were still coming together. So they were merging, they were forming marketing departments for the first time, and I did some consulting with them, some project work, and when they hired their top VP, he offered me a job. I've been in healthcare ever since, so over 25 years now for 3 great organizations, all in the marketing department, so it's been a great run.
It's great. And here you sit at Virtua. What's unique about Virtua's situation, the market, how you're organized and set up, the challenges you have to face?
So Virtua, we're in South Jersey, just outside of Philadelphia, so we've got the competition of the big academic medical centers there. We've got great local health systems as well. And like everyone, we've got disruptors that are all over the place with private equity and retail, so lots of competition. We primarily serve a 3-county area, but that's really expanding. We've grown our tertiary services, grown our medical subspecialties, so that geography is broadening out. And something people wouldn't know is we actually have over 40 surgery centers that extend across New Jersey and into Pennsylvania and Delaware. So it's a great system.
Yeah, I know you've got a position you're proud of. Can you tell us a little bit about that?
So, yeah, our brand positioning, we kind of came out into the market about 5 years ago with Here for Good. And it has a lot of deep meaning to it. It followed an acquisition of Lord's Health System, which allowed Virtua to grow from kind of a community-based system to having more tertiary services for the first time. It was the first time we had cardiac surgery and transplant. And we've continued this journey now. We're an academic center with a partnership with Rowan University, forming a college and having residencies and much more research. But Here for Good from the start meant being rooted in the community, having great clinical capabilities, but also meaning more. You know, how do we create healthier communities through all the care that happens, outside the hospital walls and that environment of care. So we're probably one of the larger organizations addressing things like food insecurity. We have a mobile farmers market, a mobile grocery store, food as medicine program. So Here for Good, means that. It means connecting with the community, doing things to create healthier communities. It's been really motivating for the organization as a whole.
Yeah, I know that just through our conversations, getting closer to the customer or to the consumer is something that's a passion of yours.
Yeah.
Things like mobile food for good, all that kind of stuff that helps. What else are you doing to really bring from a marketer's and communications perspective that others might be able to learn?
Sure. I mean, from the marketing side, one of the ways we really get close to the consumer is we've built a consumer panel that now has over 45,000 people in it. And so that really allows us to ask different types of people any type of business question. It also allows us to understand more about the services they're looking for, how they perceive us, and again, gets that deeper understanding to create a relationship, to create trust, to help people and connect them to healthcare, which we know is not always easy.
Yeah, I wasn't expecting that as an answer, actually, because I'm so surprised that you were able to get that many people together. I was going to ask you as a follow-up here, really, like, do the consumers want to be closer to the health system?
Yeah.
Because I actually don't know the dynamic of that relationship. Like, I know health systems are always pushing themselves to say, we want to be closer to the consumer, we want to... I don't know that I necessarily want a closer relationship with my hospital system.
Yeah, you're trying to stay away from the health system.
So I'm curious,
I think maybe that if we think about it more as like a partner in that health journey, so not that, certainly you don't want to partner and be coming into a hospital for care, but, as you're trying to live your best life, how do you get those wellness strategies that will help you? How do you take those preventative measures that will help you? And the way we've been able to recruit so many people is it's a combination. It's people that have filled out a patient experience survey, a patient satisfaction survey, are given the option to join this panel and continue to have a relationship with us in a new way. And we recruit people that have never been a patient as well. But it's that combination.
And you mentioned Lords. I know you've been through a few large acquisitions. We got to work on one of those large acquisitions, which is great. But I'm curious, from a marketer's perspective, is there any advice you would give people as a marketer going through a large integration or an acquisition on things you wouldn't necessarily think about?
I think people know it's a complex process. You've got to really embrace change. Things are going to change in building a new organization. And I think you want to keep that optimism of there's going to be something better. Because it can be scary. It can change your role, it can change different positions, your reporting relationships, lots of things. And I think people know that going into it. But, my advice is just kind of to embrace the challenge. And it's an exciting time to get to create something new, to create that new culture, those new values. It's really exciting.
Yeah. I'm interested in your experience, because one of the things that I push inside and outside of healthcare is the idea in a merger and acquisition that marketing is generally not at the table early enough in that process. And I'm not in any way presupposing what your experience was, so I'm curious what it was. But normally what we see, particularly in healthcare, is like, the deal happens, the due diligence happens, much of the organizational structure and integration office is set up and working, and then at some point down that process, people start communicating with marketing and saying, okay, we need to start figuring this out and that out. Which leaves a lot of the sort of the opportunistic and value-based things that marketing can do to drive synergies or efficiencies or really make an impact from internal and external communications. It leaves that more to a hurry up and get it done situation, as opposed to I've got plenty of time to plan this and really optimize it.
It's a great point. I mean, I think for the mergers I've been a part of, the marketing has gotten involved early. That was true at Virtua. That was true at Hackensack Meridian.
Okay.
It was true in some of my prior work. I think what it allows marketing to do is to really understand what matters to people. It's a business relationship, but there's a lot of strategic talk about what's going to happen, a lot of understanding of the culture, of the values. I think as you understand that, you can create better messaging, you can help tell those stories, and you're right, not having it be like a hurry up at the end when people are signing the documents and want to launch a campaign.
Right.
And it's like, well, if you were there along the way, you could have understand that value proposition, worked with a lot of people in that integration office, with the clinicians, with the business leaders, operations leaders, to really map that out. And it's a great opportunity. I mean, I think we have a lot to contribute, even if we're not the one running the deal. We're kind of telling that story, creating that narrative.
Yeah, I think there's a missed intersection a lot of times around, the organization will focus, and their consultants that they bring in. I'm not talking agencies or anything like that. They're focused on who do we keep, who do we let go, what facilities do we keep, what do we close, right? What IT systems do we integrate? Like all these, massive change initiatives, all of which actually have an impact on brand customer experience, the value of the deal, the perception in the market. And I'm not sure that necessarily gets the same level of focus that it should as a part of an integration team. And it's great that you've been a part of that.
Because it does kind of make or break things towards the end. I mean, whether you really create that common culture, whether you really create that messaging that resonates with folks, it really shouldn't be an afterthought.
Yeah. So now I have to ask, because, again, we got to work on Hackensack Meridian, many agencies at the table for that program. Why did you bring in a partner like BrandActive? And, not just why, but what was the value of doing that? What stuck with you as sort of, this is memorable that I would share with somebody?
Yeah, it's a great question. I think we had probably met at a conference probably like SHSMD.
I think so.
And just, started a dialogue. But when we went through that merger, there's so much to operationalize, and the brand is such a big investment. I think the creative agencies we were working with were really helpful in designing what that visual framework would look like, what the experience would be, what the strategy would be, but their focus is not on operationalizing it. And we wanted some help with that. And I think what sticks out, I know you created a lot of value for us in understanding that investment and helping us think about how we wanted to spread that over time. You can go really fast, you can go slower, and signage is the one that sticks out to me the most, frankly. It
always does in healthcare.
Because it's, again, when you're talking about investment, you're talking about millions and millions of dollars, and you're talking about it taking a few years. And I remember you helped us develop an RFP for that. I know it saved us money at the time, and it was just a much smoother process, and we didn't have all of that expertise. So,
I think in healthcare, signage is going to represent anywhere from 40 to 60% of an implementation budget, right? So that's the one that everyone kind of focuses in on, and then I think about documents and forms and ID badges and marketing collateral and all of the other things, legal registrations and trademarks and all that stuff that needs to get done too. So. Managing that complexity becomes very hard.
It all needs to be in a one plan, and all the things you just mentioned, every one of those is way more challenging than people might think it is. Creating an ID badge, that is not easy to do across organizations that did it differently or on different systems. So again, that was a really helpful piece.
That's great. That's great. Anything that you wanted to talk about that we didn't talk about? This has been great.
Oh, great. I think we covered a lot. I appreciate your time. I appreciate the chance to just, have a discussion.
Me too. Thank you. I appreciate you.
Thank you.
Thanks for the time.
All right.
All right.